Opioid overdoses killed more than 800 people in Wisconsin in 2016. That's compared to 469 deaths 5 years prior, illustrating the growing epidemic. News 8's Madeline O'Neill shows us how a new agency in Wisconsin is becoming a part of the solution.
Lisa, the Wisconsin State Patrol has outfitted its nearly 500 troopers and inspectors with Narcan, the life-saving drug that reverses opioid overdoses. It's new territory for the officers, but officials say the more Narcan available, the better.
With the ever-increasing deaths in the state of Wisconsin, it's not slowing down anytime soon.
The opioid epidemic is changing the way Wisconsin State Trooper Ryan Smith does his job, putting him in the driver's seat in the fight against overdoses.
As officers, we are emergency responders as well.
He's learned the signs of an opioid overdose.
Irregular breathing, no breathing at all, very slow heartbeat, blue on the fingertips or the lips.
Smith never thought his position would call for administering the overdose-reversing Narcan nasal spray he now carries everywhere.
Absolutely not.
But since he's often first on scene, having the extra skill in his tool belt can mean the difference between life and death.
If you're a family member or have a loved one that's addicted to heroin or opioids, I can't stress how important it would be to have this life-saving drug.
Health educator Al Bliss says with increasing overdoses and the growing use of potent opioids such as fentanyl, Narcan access is more important than ever.
The more individuals, more professionals that actually have access to this are going to improve saving lives and improve getting people back on the road to recovery.
Within the past month, a state patrol trooper already saved a life with Narcan in northern Wisconsin. And while Smith says it's disheartening that the opioid epidemic has driven troopers to carry Narcan in the first place.
At the same time, if it happens, it makes you feel good that you were able to get there and save someone's life, and they get a second chance to maybe turn their life around.
In 2017, La Crosse's Tri-State Ambulance distributed less Narcan to fewer people than in the previous year.
Why might that be?
Well, it's not necessarily that overdoses are going down. It's more that Narcan is more available elsewhere in the community. Not only are more first responders such as police and now state troopers carrying Narcan, but it's also available over the counter at pharmacies, and it's free at the AIDS Resource Center of Wisconsin here in La Crosse.